I'm Munir Velji. I'm the practice and standards lead at the Bloom Group, and I've been there for about 10 years. And yeah, my background is I've been a social worker now for 26 years, and 10 of those have been at the Bloom Group. And so I oversee basically any type of practice and standards issues that arise, as well as give sort of clinical direction to various programs. And we have a number of different programs there. When we talk in the field, a lot of times we're talking about mental illness. And so when we talk about mental health, we're not just talking about, just the sides of it where people have, mental health issues or mental illness, but also about mental wellness as well. And so I think to differentiate what is a mental illness as opposed to what is mental health is important, because we also want to focus on what it means to be, mentally healthy as well, much like we do, in terms of physical health. So, we know that in terms of mental health, that a big part of the community, anywhere from 20 to 25% will have a mental illness of some sort at some point in their lives. So it is definitely something we want to focus on. But I think in terms of looking at things holistically, we want to look at everyone's mental health and what does it mean to be mentally healthy as well. I think that, there's definitely there's a lot of stigma associated with that, I think. And I think that, in terms of homelessness, I think one thing is that people think that everyone that is homeless has a mental illness, and that's not necessarily true. I think that people also really feel that mental health or mental illness in particular only affects, people that have poverty or have substance misuse or any of those types of things. And I think that really when we look at the statistics, especially Canadian statistics, we know that it doesn't differentiate between social class or social status or anything like that. Really mental health, or at least mental illness in particular, can affect anybody in any sort of walks of life. And so the other assumption is that, yeah, all homelessness, it relates to mental health or mental illness, when we know that really homelessness is complicated. It's not just simply people that have mental illness are homeless, because we know a lot of people that have mental illness do have homes, and vice versa. And so, there's a lot of things that affect homelessness, whether that's poverty, whether that's trauma, whether that's, childhood attachment. There's a number of things that's involved in that, and as well as just the availability of, safe homes for people. And we definitely don't have, we don't have enough of those in the community as well. There's a number of challenges with that, and one of them is absolutely, of course, some stability, right? And when we talk about treatment, treatment isn't just about people's sort of biological process or physiological process. It's also about their environment. And so when they don't have if you don't have stable housing, you don't have food security, for example, things like that, it's really difficult to affect change when we're talking about treatment as well. The other challenge with that is just even if they're on medication, for example, accessing those medications, having the money to pay for those medications. If you're homeless, also not having an address or not having sort of a stable environment where say a clinician can meet with you, or if you can't access services in the community, whether that's a mental health center or a counseling center, or that you're kind of really, when we talk about needs and we talk about what people's needs and priorities are when they're homeless, often it's not about the treatment. It's really about finding safe, affordable housing, or it might be about food security and just trying to get food when you're out on the street, that type of thing. So that also becomes a problem in terms of accessibility. And so we do have some outreach teams that do go and try and meet with people where they're at, but there's certainly not enough of that. And we still are very much, if you were going to see a physician, you have to go to an office to access that, and that's not always accessible for various reasons. When, especially like I said, when we talk about where people's needs are, that's often not the first priority. It's always easy to say, we just need more money and more resources, and that's not always. I don't know if that's always the case, but I do think that our housing is. I think we need more varied housing. So meeting people where they're at, and so we talk about things like, can people come into housing with pets, for example, right? A lot of people that are homeless might have pets, and so a lot of our shelters don't take pets. So things like that, in terms of accessibility, can be a problem. We know there's not enough housing for sure. There's not enough, in general. If when you look at BC housing and their waiting list, it's anywhere from a year to 2 years for people to get safe, affordable housing, and so it is a long process in terms of that. So in terms of long-term housing, in terms of safe and affordable housing, we certainly don't have enough, but we also don't have, I don't think, a lot of flexibility in our housing. And so sometimes, there might be a facility, there might be some type of housing, say an apartment or something like that, but they have a lot of limitations on them. And so whether that's geographically limited, because we forget that people also that are homeless have family and friends, and they want to be close to them as well. And so sometimes it's geographically also a challenge as well. So there's a number of challenges in terms of that. And then again, flexibility around services. So having, treatment on site, or having, counseling available on site, things like that could be helpful, is not always possible and not always there, right? So yeah, I think two things. One is definitely more housing for sure, but also some flexibility around that housing. And like I said, allowing pets, for example, or allowing families, couples, that type of thing. We don't have a lot of shelter space that accommodates that. Right. So what our research tells us, that when we have things like stable housing, food security, that people do a lot better in terms of their mental health, because they have some stability in their lives, right? If they're not worrying or stressed out about finding housing or finding food or finding any of those types of things, they're certainly in a better place to deal with whatever mental illness or mental health issue they might be struggling with. And we see that not only in the research, but we also see that, I can tell you from the Bloom Group's perspective, we do have a number of mental health facilities, and a lot of times when people come to our facilities, they're quite unstable, but once they have stable housing and again, stabilization in terms of medication, as well as in terms of nutrition and that type of thing, they do a lot better from their mental health standpoint, and they're able to actually improve their quality of life. So we know that definitely adds to it in terms of that. And when we're talking about substances and things like that, it also, the more services we can provide and the more flexibility around those services, people do a lot better. For sure, we know that having support services can be really helpful. So things like having counseling available, having counseling not just for counseling's sake, but very, very targeted on different areas can be really helpful. We know that being managed, so case management, so having somebody that say it's a social worker, say it's any type of case manager that oversees somebody's care. And so, when we look at people, we also address them holistically, rather than just looking at substance use or mental illness, or kind of breaking it up, which is what the system essentially does, is we kind of break it up. Housing is separate to counseling, and so having kind of a holistic view of things can go a long way towards helping people. And also, sort of that one-stop shop in terms of, having services available all under one roof can be really beneficial. And we're seeing that in the youth system. There's a new system called Foundry, which it's not that new, but a couple of years now, where they have, housing services, counseling services, income assistance, all of those types of things. Those people all work together on a team, and it just bodes well, and it's just, the prognosis is just so much better going forward when we have people like that as well, all working together instead of separately. So case management's a big part of it for sure. Just trying to have one person in charge, but also having all the people that all the service providers, someone is actually accessing, working together rather than at odds with each other. We have historically for many years now run a mental health housing, and we have the largest one in BC. So Victory House, which is 47 residents that live there, and so we have a number of smaller ones as well. So Santiago Lodge and Cecilia, and so the Bloom Group has always, because of the neighborhood we live in as well and work in. We're very dedicated to and where it came from was really just trying to serve the people that were homeless and living on the street and bringing them inside and providing safe, affordable housing. We really believe that, we're very focused not on housing particularly, but also on just creating a home for people. And so if you were to look in our facilities, we purposely not make it institutional. So even the colors we use, in fact, we have plants and we have couches and lounges and those types of things. And so we put a lot of effort into making sure people feel like it's their home. They also have, people that live in all our facilities have capacity to give us feedback on what they think of what's working, what's not working, what can be improved. So we have, from our mission, really our mission statement, we provide housing for the most vulnerable, and we see a lot of the people that live with us to be very vulnerable. And the great thing about our facilities is they don't have to move. So we're not short term if they want to live there. We have people who've lived there 25, 30 years, and they're absolutely welcome to live as long as they can in our facilities as well. And so even in terms of our staffing ratio, we have activity programs, all those types of things. We have a work program, just trying to improve people's quality of life. And I mentioned case management before, and that's the model that we use, as well as a recovery model for people that live with us. So it's very purposeful in terms of that. And in terms of housing, we have a wider range of housing, but we certainly we are quite dedicated to ensuring that the people that live in our community have safe, affordable housing as well. We do have yearly case conferences with clients to exactly do that, which is goal set for the following year. And so the goals for individuals, they are very individual. So one individual may have very different goals than another individual, but I think overall what we are looking for is to improve quality of life. And so we want to make sure that people from a mental health standpoint are stable, but also that they improve their quality of life. And that happens in varied ways. Some people take they partake a lot in our activities program. So, they're involved in exercises and community visits and all sorts of, recreational opportunities. And then we have other people who, their quality of life is improved because they actually they get to a point where they can work. So they either work in-house in our facilities because we have a work program, or they go out and they work in the community as well. And so we also have people who've, taken a course or some vocational type of improvement in their lives. And again, it's all directed by the people, the residents that live there. They provide what goals they wanna seek and meet. Yeah, so it is a program, and that is a little different than some mental health housing. It's actually different than some of the mental health housing we run. But for our licensed facility in particular, which is called Victory House, the referral has to come through mental health housing, which is through Vancouver Coastal Health. And they have to have a diagnosis. They have to have a mental health or mental illness, essentially. So a diagnosis of schizophrenia or depression or bipolar, or any type of diagnosis. And then the expectation is really that they do follow a program. It's not a really strict program, but it is, we do have, there is, for example, we have a meal program, and so they need to follow that. They need to be compliant with medication if they're on medication. And they need to, engage in the community programming that's occurring. And so we have all sorts of different things that are going on. And so, we have a various amount of activities. So, they can go on a day trip, they can play bingo, they can go to exercises, they can go and work in the work program. So there's lots and lots of options for that. And there's no expectation that they do that right away. We understand that when people come to us that they have to adjust. And so, yeah, there's an adjustment period. There's time for people to get comfortable. All the facility is not a locked facility in any way. They're given keys to come in and out of the facility, and they're given keys to their room. They're all single rooms, so they have their own private space as well. Yeah, no, I think so. Something like this is really great, and I think that the more education we have, the more, the more education in the general community, not just the homeless community, about mental health. I think in general, I think that I'm seeing more and more of that. I've been doing this a long time, but we're still a long way away, and I think there's still a lot of stigma associated with that. And when we talk about the homeless population, there's stigma around being homeless, let alone having a mental illness, for example. So I think that advocacy, and I definitely think education is the way to go. And I think it starts with in terms of your organization, it sounds like mostly young people in terms of high school and university students. And I think that's where it starts. I think that the more you're educated about some of those issues, the more you can affect change. So I commend you on that, but I also think that that's where it starts, frankly, because we still have a long ways to go. Even though, like I said, I think the stigma has lessened, but not to a certain extent. I mean, we just have to look at the fentanyl crisis right now, and how many people have died from that just in the last 2 months. And even though people are talking about it, certainly, and way more people have died of that than COVID. But and I understand why we're focused on COVID, but I think we can be focused on both at the same time. And so it's a real issue, and it's been a real issue for a long time. So